Hi, this is Dr. O here, and thanks for tuning in to Ask Dr. Orbeck. I want to make sure you don't miss a single episode of the show on YouTube, so before we continue, be sure to subscribe to our channel and ring the bell to get notified about our latest videos. If on your phone, just go into the settings and switch on notification. Thanks so much for watching. Hello, everybody out there, and welcome to our monthly live stream, Ask Dr. Orbeck. This is a program where I address common questions that I get from patients at my practice here at Regenerative Medical Institute. We are located here in Greenville, South Carolina. At RMI, I specialize in areas of metabolic and rejuvenation medicine. I have emphasis here on sexual wellness and intimacy. That's near and dear to my heart. And my wife and I really work hard with our patients to help them have quality of life as they get older in intimacy issues. Today, we're going to discuss some common questions that I get regarding menopause, as well as sexual dysfunction in women. Plus, we will go over some additional options of relief that I provide here at Regenerative Medical Institute. Now, remember, you can always visit my website, rmi.live, L-I-V-E, for more information and to book a consultation. But for now, let's get started on this week's questions. And the first question is, what are the signs and symptoms of menopause? So menopause is a natural transition. It's not a disease, and can become a very difficult process. During menopause, more than 75% of women experience a whole host of symptoms. Menopause is defined as not having a period for over 1 year. So after 12 months, if you're period-free, you're considered menopause. Before menopause, you're in a perimenopausal state. In the perimenopausal state, hormones fluctuate all over the place, and you can also have many types of symptoms. So some of these symptoms are as follows. The first is hot flashes and night sweats. I'm sure all of you at some point have experienced that if you're going through menopause. That's related to estrogen. It's related to progesterone. It's related to what we call the EP ratio. Balancing the estrogen and progesterone is very important. Memory issues and mood issues are very important. And that's also related to both estrogen and progesterone. Fatigue often occurs. I often talk with my patients about the difference between the anabolic and catabolic. In a catabolic metabolism, you run more on cortisol, less on the anabolic steroids such as testosterone, DHEA, androstenedione. And so when that happens and you become catabolic, you get very fatigued. Hair loss and sagging of skin is very common. It's related to estrogen, testosterone, and all of the steroidogenic hormones. Bladder problems do become a problem. I often see these issues in women that have had childbirth. But even if you haven't, bladder problems can become a problem when you become hormonally deficient. Estrogen plays a really important key in bladder health as well as urinary continence. And so if you're working out at the gym and you're doing sit-ups or working on a trampoline and you're leaking, that may be hormone related. Low libido is often related to testosterone. Testosterone is not only a hormone in men, it's very important as well in women. So the testosterone-estrogen ratios basically in men has 12 times the testosterone that women have, and in women, they have 12 times the estrogen that men have. So most women reach menopause around the age of 50 to 55, okay? It happens usually after 12 months of having no period, you're actually clinically described as being in menopause. But like I said, you can be in perimenopause for up to 5 or more years. While the symptoms that we described, while they may continue on their own, sometimes they stabilize a little bit as the hormones begin to stabilize, but they often last for years. And in some women, I see them actually get worse, especially in the urinary issues, libido issues, and sexual wellness. More than half of women struggle with chronic low libido after menopause. So if you're struggling to cope with the effects of menopause, please know that you're not alone. There are treatments available. Reach out, get some help. It will enhance the quality of your life. Now, let's move on to the second question. What causes sexual dysfunction in women? You know, millions of women suffer from sexual dysfunction. This may be from intimacy issues, libido issues, the desire. It can also result in painful encounters. Vaginal dryness has an issue, and sometimes just the active sex become very unsatisfying. And when it becomes painful, that's not a good thing. It affects the quality of your life. It affects the overall relationships that you have with others. So this is a very important aspect of health. Studies have estimated that more than 25% of women struggle with sexual dysfunction. And as we said, after menopause, that number can climb to as high as 50%. Sexual dysfunction in women can be caused by hormonal changes. Hormonal fluctuations can trigger sexual decline. During your 40s and 50s, your estrogen levels drop, your testosterone levels drop. You may have issues with libido. You may have issues with sensitivity, and you may also have issues with pain. Hormones support healthy libido. Hormones support vaginal tissue. They allow for vaginal tissues to become firm and toned, and it also promotes a healthy blood flow. So don't forget that these hormones actually signal the DNA within the cell. They tell the DNA in the cell how actually to instruct the cell on what to do. And the cell's role is to do what? It's to make protein. Hormones do, however, have an effect, like we talked about as well, on blood flow. So let's talk about childbirth for a moment. Pregnancy and childbirth is a wonderful thing. It's a very pleasing thing, but it often takes its toll on women's vaginal health. So during pregnancy, your pelvic floor muscles may suffer severe strain. When you have a child through the vagina, a vaginal delivery can worsen these symptoms. Some women experience tearing or scarring or other physical trauma during the birthing process. So patients sometimes report ongoing pain or pelvic weakness even years after giving birth. There's help for this, and so you need to reach out and look into these issues, look into help if you have any of these issues. Let's talk about chronic illness now. Some of you may have medical conditions, chronic conditions that can interfere with intimate wellness. Some of you may be on multiple medications for your chronic conditions. Chronic illnesses like autoimmune disease, heart disease, or other chronic conditions can trigger sexual dysfunction. Certain medications that you take can also affect your vaginal and bladder health. So, looking at all these aspects, it's no wonder as we age that our sexual wellness can have a serious effect and may decline. Please know there's help available and you can regain that wonderful sexual intimacy that you had in your when you were younger. Now, what can provide relief from what we talked about? Let's talk about this for a second. So here at Regenerative Medical Institute, we offer a wide range of options to treat symptoms of menopause and to treat the causes of sexual dysfunction in women, as well as men. Treatment for symptoms of menopause include the following. First of all, I'm going to take a good look at your blood as well as your urine, all of your hormone metabolites, and I'm going to diagnose what underlying conditions there is with hormonal decline. We can help with severe hormonal fluctuations that don't go away. I can give you bioidentical hormones that actually stimulate the cell the way they're supposed to be stimulated. This is different than conventional hormonal therapy. Bioidentical hormonal therapy gets to the root of the problem. Some of the ways that I give hormones include creams or maybe oral pills, but in a lot of situations, I'll use what's called subcutaneous pellet therapy. This is sustained release hormonal delivery. And what I love about this delivery is that when I insert a small hormone into the fat, it's surrounded by a capillary bed. That capillary bed is connected to the heart rate. And so what happens is that as your activity increases, the blood flow increases, it pulls more hormone off around that capillary bed from the pellet. So what actually happens is you have more of a physiologic release of hormone. That's called a circadian rhythm. And that's why subcutaneous hormone delivery is often more effective. Let's talk about skin rejuvenation and hair restoration. So sagging of the skin is common with aging. It's common with hormonal decline. Thinning of the hair often occurs as we get older, and it's very common with hormonal decline. We offer services that can help plump up the skin, stimulate the hair follicle to make more hair, increase blood flow in both the skin and the hair issues. We offer hair restoration using platelet-rich plasma, combining that with peptide therapy to stimulate the hair follicle to grow. So don't just settle for oh, I'm going to look like this the rest of my life. There are rejuvenation procedures that actually work at the root of the problem, working at cell signaling to help restore and regenerate the underlying problem, giving you a more youthful and vital look. Let's talk about intimate wellness now for a second. The treatments that we offer can restore your most intimate issues and areas, and so you no longer have to struggle with painful sex, difficult sex, or even not wanting sex. Treatments of this may include some of the following. I offer the O shot. Fantastic procedure. I love it. It's one of the most common procedures in my practice, and women talk highly about it. I draw some blood out of your arm, about 60 cc's. I spin the blood down and pull out the growth factors. These growth factors are then stimulated. Okay, once I stimulate the growth factors, I inject them. When I use a nice, powerful numbing cream, it is painless. When you have the shot, you'll feel like you have to urinate. You'll feel like an urgency. It lasts for about maybe 2 or 3 minutes, and then it goes away. And what happens when I put these growth factors in the vagina, they stimulate the body to rejuvenate around that area, strengthening muscle, improving the mucous membrane, and improving blood flow. The next thing I often do is called Votiva. Votiva is by InMode. It's a non-invasive procedure where I take a small wand, put it into the vagina with a lubricant, and it's warm, so it's not uncomfortable, and I bring in radio frequency. Radio frequency energy is different than laser therapy. Radio frequency energy is very safe. It will not cause burning, and it's often done under a guidance that we can't bring the temperatures above a certain degree. So there's added safety measures when we do radio frequency. But radio frequency is unique in that what it does is it stimulates the vagina for growth, healing, and rejuvenation. It helps tighten the pelvic floor. It helps tighten the vagina, and it helps weakened tissue become stronger. And then I combine that with either Apex or Intensity vaginal devices, which what they do is they offer kind of an electrical stimulation. It's under a controlled situation that helps strengthen your pelvic floor. This is done in your own home. So you can do this after these procedures to maintain what we have achieved here in the office. So when we combine hormonal therapy, get into rejuvenation medicine, fix the underlying problem, stimulate the body to rejuvenate, sexual wellness can increase, intimacy can increase, and your overall pleasure in life will be much more satisfying. So, in conclusion, are you ready to learn more about vaginal rejuvenation? Are you ready to learn more about intimate wellness and what services is right for you? Please contact me at Regenerative Medical Institute. Schedule a consultation. Let's talk freely about these issues. There are things I can do to really help. So that's it for today. We had a great time. I look forward to talking with you soon and to great intimate health. Thank you. Thanks for tuning in. If you like the show, please be sure to leave a review wherever you listen to the show. Also, make sure that you like and subscribe so you don't miss an episode. Great to have you here, and see you next time.